So what are we doing in Lagos? Well, the government did something very significant in 2022. The President promulgated the National Health Insurance Act law, President Buhari. And what that law did was to give us the means by which to start to drive a culture of health insurance in Nigeria. And that law said that every Nigerian must carry at least the basic minimum social health insurance enrollment. So it's now law that if you live in Nigeria, you must carry social health insurance. So it's up to the states now to domesticate that. So Mr. Governor has been very quick. In less than 12 months, we released the Lagos State Executive Order on domestication of the National Health Insurance Act, which mandates Lagosians now. So in the last 3 months, it's now become law by an executive order that all Lagosians must now carry social health insurance. Now, for a small figure of about 15,000 naira, it covers you for a period of a whole year for a basic minimum package which covers medical checkups, fevers, birth control, immunization, minor operations, investigations, birth, cesarean sections. So 80 to 90% of what most Lagosians need. I'm not saying that if you have a major sickness that requires brain surgery and all that, it won't cover it. But then we will take you to one of our general hospitals to deal with that. But everything you need, if you have a fever, you need fertility medication, you need antenatal care, you need immunization, all that is covered with a basic health insurance plan. And so what we're trying to do is now enforce it in Lagos, encourage Lagosians that this is in your best interest. It pushes resources into the system, it makes the system more viable, it brings healthcare back into the mainstream economy. And when health is back into the mainstream economy, it now becomes attractive for investors, and so that's one of the ways in which Lagos is trying to change the ecosystem of healthcare delivery. And so you will see in 2025, we're going to be talking a lot more about health insurance. We're partnering with the private sector so that we can make it easier. If you already have a private health insurance, you don't need to go and buy a social health insurance plan. We're just going to fuse them and make it very simple for Lagosians. But we're going to be serious, and we're going to say, if you're living in Lagos, you're enjoying the commercial environment that this government is providing for you, your responsibility is to own social health insurance, which makes it possible for you to receive health care without out-of-pocket spending and what we call catastrophic health expenditure, because you never know when you're going to need that protection.
And they're sure to get the service.
And we're sure
because sometimes, people are skeptical about some of these things and say, okay, you just...
Well, it goes hand in hand, because when you pay your insurance, it goes into the system. The system, the finances start to revolve in the system gets richer, gets better, there's more competition. And so we're looking into a very bright future for health sector in Lagos.